because of oxygen shortage related deaths. Some that were reported in Goa as well. But now there has been a 3-member committee that has been appointed by the Goa government, and it has decided to give a clean chit to the state government, saying that the state government is not at fault here in the oxygen crisis that resulted in 80 deaths in the month of May this year. The panel instead here has blamed the GMC. It has found here that the Goa Medical College did not raise the issue well in time. It has come down heavily here, saying that this, in its 35-page report here, it says that the GMC was unable to avert this crisis. It has also noted here nothing was unusual about these deaths, and that the hospital here is solely responsible for these deaths that have taken place. Remember, this is a huge number of 80 fatalities that were reported there in the month of May. But the opposition political parties in the state of Goa have slammed the panel in choosing to give an all-out clean chit to the state government here. It is called it a desperate attempt here by the state BJP government to get absolved of the crisis. Meanwhile, the Forward Party leader here, Durga Das Kamath, has demanded Chief Minister Pramod Sawant's resignation on this issue.
It's shocking that the probe panel report, which has been out in public domain today, in the newspaper, local dailies, have brought out the truth, what Vijay Sardesai had been speaking during the second wave crisis, oxygen crisis in Goa. At that point of time, Chief Minister said that we are trying to take political mileage out of COVID. But it's now crystal clear that the second wave was completely mismanaged by the state BJP government.
Let's get in my colleague Mayuresh Ganpati getting us further updates here on this. Mayuresh, we're now looking at an ugly political face-off, a blame game that has started here. But going into the details of what this committee report says on how it continues to justify that the state government is innocent and it is the GMC at fault that didn't raise the alarms or avert the crisis.
Absolutely. In the month of May only, this committee got constituted by the state government, and on 23rd of July, this committee submitted its report. Now that report is out in open and in public domain. So report clearly says that it was GMC who's at the fault because they didn't manage it properly. When in the month of May, the resident doctors had written letter about the oxygen crisis, about the oxygen issue, but GMC management didn't respond to those letters. Number two, the important point that there was an agency which was providing a supply oxygen to the particular hospital, that is GMC, but there was no backup plan in case of the emergency that GMC was having. So all these kind of blames, they have put it on the GMC management. But we have to look this thing that GMC is, that is Goa Medical College, is a government medical college. It is one of the largest and the biggest medical facility in the state of Goa. It is run by the state government. So when you're putting or blame on the Goa Medical College or the management of the Goa Medical College, we have to see that it is run by the state government. But in the report, they have not mentioned anything about whether it was a fault of the state government or anything about the state government. And that's why we are seeing this kind of political reactions which we are getting from the Goa Forward Party or from other political parties from the Goa, where they are asking for the resignation of the CM. But as I said, this particular panel, 3-member panel headed by the IIT Goa head, has given a kind of a clean sheet to the Goa government, and they have put blame on the Goa Medical College management for entirely mismanaging, or we can say entire mismanagement which happened, where 80 people died. They also said in the report that Goa Medical College was not having a proper data of patients and how many patients died and because of what they have died.
Right, but Mayuresh, what is the counter to this? Does the report not take into account the other side of this, or what the GMC has maintained all along, that there was a shortage, there was a crisis, they had informed the state government well in time? Where is the other side to this crisis here in this report?
State government, especially if you remember, it was Vishwajit Rane, the health minister of Goa, who raised this issue first, that the deaths which are happening or deaths which happened on that one particular day and the number was in double digit. That must have happened due to the lack of oxygen or due to the oxygen issue. He was the first person to raise it. But we did try our level best to get in touch with the Goa government for their response, but there was no response which we got so far from the Goa government.
Right, Mayuresh, we'll have to leave it at that, but we'll take this up more in detail in the coming few hours through the day here. Because remember, as far as the medical technicality of this goes here, the reasons that were given out on the death certificates on the cause of death, remember, technically, cause of death cannot be stated as oxygen shortage. Has that in turn worked in favor of this report leaning towards granting innocence to the state government here on this? We'll leave it at that.